and this is a notion that's existed since Greek times to Silicon Valley, the TV show, like drinking, blood from the youth. There's something in it that's probably helpful in this specific case.
Welcome to the Strokecast. A Generation X stroke survivor explores rehab, recovery, the frontiers of neuroscience, and how to peel a banana with one hand.
Hello, I'm Bill Monroe, and welcome to episode 55 of the Strokecast. Strokecast regular neurologist Dr. Nirav Shah joins us again this week to talk about remote ischemic conditioning. We'll dive deeper into it in a moment, but essentially it makes the body more resistant to oxygen deprivation by depriving it of oxygen. It's a fascinating area. In some respects, it actually does the opposite of hyperbaric oxygen therapy. As we learned back in episode 48, the theory is that hyperbarics, which flood the body with extra oxygen at high pressure, can bring back the stroke-damaged brain tissue and help with recovery. And while hyperbaric oxygen therapy does help for a lot of conditions, the science is pretty clear at this point that it doesn't help for stroke. Remote ischemic conditioning, however, does appear to have positive results in the early studies and may be helpful in the future. So does this mean you should go out and tie a tourniquet around your limbs and give it a shot? Absolutely not. That would be a terrible idea. Well, at least for now. But that could all change in the future, so keep an eye on the field. Dr. Nirav Shah is a neurologist at Swedish Medical Center here in Seattle and the founder and CEO of Sentinel Healthcare, a company developing new tools and communications platforms to help patients and physicians monitor and treat high blood pressure and prevent future strokes and other conditions. You can hear my previous conversations with Nirav over at strokecast.com/Nirav. So now, let's talk with Nirav about remote ischemic conditioning. So Nirav, welcome back once again.
Thanks for having me, Bill.
I think today what I want to talk about is a new thing I've just heard about, and that is remote ischemic conditioning. Now, I think most of us who have been involved with stroke as survivors, as bystanders, or as medical professionals for a while know pretty much what we mean by ischemic. We're referring to a clot in the blood vessels leading to stroke. But what is this remote ischemic conditioning about?
That's a great question. So remote in this case doesn't mean far away in the physical sense. It means far away in the time sense, so temporally. And so remote means far away from. Ischemic means lack of oxygen or blood flow. And conditioning means making the body better and giving it, some response. And so basically remote ischemic conditioning is something that causes the body to have a general lack of oxygen and blood flow that makes it stronger. And this can be in a myriad of types of cases. So outside of the brain, just for a moment, remote ischemic conditioning has been studied in athletes where, for example, swimmers, they take times when they're swimming without breaths, and so they're stronger. They have better heart function than other athletes, for example. They're better able to tolerate lack of blood flow, clinically speaking.
Because they're holding their breath so long while swimming. And is that also then why athletes will often train in Denver or in other places at higher altitude?
Well, not quite. I mean, that has a little bit to do with more with the body's ability to hold on to blood and oxygen, hemoglobin. But in this case, it's known to be helpful at conditioning, and maybe there is some effect there. You could be right. In other scenarios, we know that if people have been exposed to some event that makes them prone to having lack of blood flow, that tissue, whether it's muscle or otherwise, is better at sustaining lack of blood flow. So a good example is the heart. If someone has a lot of blood vessel disease in the heart, it's easier for them to tolerate a surgery, like a transplant of some kind, or a cardiac surgery, like a bypass, if they have been exposed to some brief periods of temporary lack of oxygen to tissue. And then another example is in transplants and other types of things where blood vessel is important to the healing. And so people who've been conditioned with ischemia are also better. And so let me make this a little bit more clear. When we talk about this, the way remote ischemic conditioning works clinically is really simple. It's just putting a tourniquet on the body, like a blood pressure cuff, and then clamping down to the point where you feel a bit of pain. That pain is acidosis or lactic acid building up, and that's the remote ischemic conditioning that your muscles are feeling. And people think...
And that's also what you feel, for example, if you, especially if you're not an athlete, if you do a lot of running and you start to feel, your muscles really start to get crampy and tired, it's that lactic acid buildup.
Exactly. And something about what happens in that process, aside from the lactic acid, is incredibly important to protect the body in many tissues, whether it's the heart or other muscle or other organs and the brain, from injury when it has lack of oxygen. And so the idea is somewhat simple. I'm definitely oversimplifying, but it's that if you've given the body these exposures, it starts to regulate these protective factors, and people just broadly refer this as vascular milieu. There's some milieu, some stuff in the vascular tissue that's excreted in the blood that helps create these protective factors.
So it's almost like it sort of helps them be more efficient with less oxygen. It almost calls to mind somebody who maybe if they are used to or adapt, whether because by choice or not by choice, because of where they live, they have to adapt to living on, 800, 900 calories a day.
Yeah.
That person can get a lot more value out of that food than somebody who's used to living on 6,000, 7,000 calories a day.
Exactly. Yeah, and the way people started realizing this scientifically was they realized that if, for example, they had a mouse that had been conditioned and they took the blood from that mouse and filtered it and gave that filtrate or that diacylate to another mouse, that it would protect that mouse who hadn't been conditioned from lack of oxygen.
Interesting. So it's making the blood itself becomes more efficient at transferring the oxygen to the tissue, and the tissue becomes more efficient at managing that use.
That's correct, and that's what I meant by this vascular milieu. And so what we now know is that in these lab models, it can be protective, and people have started identifying them. There are a whole host of factors that are vasculogenic that come about during these periods of low oxygen in the body from the blood. And then in the case of stroke clinically, the story is also pretty interesting. We know that people who have plaque in the legs, from smoking specifically, peripheral vascular disease, people with that plaque have smaller strokes when you control for age and gender and some other features, which is surprising. Because usually you would think, that would be worse. Mm-hmm. Someone who's at risk would have bigger strokes, or at least the same. So that's a bit curious. And then another thing...
So would it be correct in saying that while they are more likely to have a stroke, when they have that stroke, it will be less debilitating, most likely?
Yeah, it'll be less volume of tissue affected. And similarly, if someone has had a TIA event, a transient ischemic attack, or what we think of as a precursor to a stroke, those people who go on to have a stroke have smaller strokes, perhaps because of the same thing. And so when we kind of look at this problem for a lot of different angles, we realize there's probably something here. And then another example clinically, after someone has a subarachnoid hemorrhage, there's bleeding, and that bleeding causes inflammation, which then can cause lack of blood flow because the arteries get narrow from vasospasm or spasming of the arteries themselves. Those people who undergo remote ischemic conditioning potentially have less stroke from this vasospasm because their brain's been protected.
Interesting how it sort of helps protect that and do that. So one of the things that this makes me wonder about too then is we know that one of the other contributing factors to stroke and to hypertension and to diabetes and a whole bunch of other things is things like sleep apnea. Now in sleep apnea, while somebody is sleeping, it means they stop breathing. In my case, I've talked about this before. I was stopping breathing 59 times an hour while sleeping. So you don't get good sleep because you're cutting off your oxygen and your body wakes you up so you can actually go ahead and get a breath in there to get oxygen. But that also then presumably means you have less oxygen in your blood while you're sleeping than you might otherwise. And your brain is now surviving on less oxygen. So I don't know if the research has been done on this yet, but does sleep apnea, while it causes other problems, also promote the remote ischemic conditioning?
I think you're right. It might, and this is where it gets confounded and complicated because there are too many things happening at the same time. And so part of what's challenging is, teasing apart these things. And as far as I know, and a quick literature search doesn't really reveal sleep apnea itself protecting stroke, but it does appear people have thought about it and are looking at it as a mechanism in other areas. For example, there's an article talking about how maybe it's responsible for the decline in mortality as people age. So maybe you're right. There's a good point. But again, as you can start to get a sense of, these things there are too many variables and they get confounded and it's hard. And so even though we have simple lines of kind of evidence, we try and add them up and try to do something about it. And so that's where we are today in 2018. There are multiple studies that have happened that are kind of safety studies. They're leading to efficacy studies. And the most exciting of these studies is a small study done with colleagues in LA, Boston, and China, where the patients are all Chinese, and they underwent remote ischemic conditioning. So they had this tourniquet-like device, basically a blood pressure cuff. Mm-hmm. They would inflate and deflate and inflate and deflate. And what's phenomenal is that even though it was 30 patients, some of these patients had reversal of the inflammation or the white matter changes in their brain. And to my knowledge, this is one of the first studies that has clearly demonstrated that change.
Interesting. And that, that's, I wonder if that could ultimately, and here I go, wild speculation, but ultimately have end up being a side benefit of those leg squeezy things we wear in the hospital.
Could be. Yeah, I don't know. I mean, usually those things don't even work that well, but they do. Right. Yeah, they do cause. You're right, a little bit of local ischemia from that tourniquet-like effect, and so I think it could be, and probably no one really knows because no one's done that careful study. And so clearly what's left for us to do next is a big study to see if we can prevent strokes in people who are at high risk by doing this.
And it sounds like, so as this research is going on and we're really, just starting to understand just the intricacies of how oxygen and blood flow and oxygen deprivation affects neural tissue, if somebody wanted to take action based on this preliminary data, it seems like the wise thing for them to do would be to take up swimming or, again, engage in exercise on a regular basis, the stuff that we're encouraging folks to do anyway from a healthy lifestyle perspective.
Yeah, that's correct. And probably at some point soon, once we have the data from studies that are ongoing in Europe and other places, there will be mainstream devices. One of the papers that we'll put in the show notes kind of shows a picture of one of these devices in the PDF. And so you can get a sense of what these look like. And I think pretty soon it'll be something that would be reasonable to try because there's no harm, basically.
Right.
There's no harm in doing it. The challenge in these studies has been compliance and adherence. Because of the pain that's caused and, to get the healthy dose, so to speak, of ischemic conditioning time, many people just drop out of the study because it's painful. Imagine that blood pressure cuff. Towards the end, it starts to be annoying and painful. Right. Now you have to do that for 30 minutes.
Right.
Right. So nobody really wants to sign up for that. And so,
and if you're already on blood thinners, it's probably also causing bruising.
Yeah. So there are a host of pragmatic problems with this. And so the challenge and the balancing act is, well, here's a non-invasive therapy that could potentially reverse brain disease and maybe even help your blood pressure, incidentally, alongside, all the other things we've talked about. Yet it's a little bit difficult. And so as you point out, Bill, I mean, the obvious ways to get at this is through the standard ways, exercise and things that are good for your heart, aerobic, and just condition your body. And then the other things to think about long term would be if someone can't do those, is this something reasonable? Well, it's not FDA approved. It won't be FDA approved for a long time because these studies just are taking forever and attrition rates are high. I think it would be reasonable for someone to try on their own and knowing that your mileage may vary.
Right. Hey, if there's something I can do while just sitting there watching NCIS, sign me up.
Yeah. And then maybe, the point we should make is the holy grail here is what is in that diastolate? What is in that fluid, that vascular milieu, that when someone is experiencing these symptoms, what is the chemical there that we could give someone in a medication or injection? And, this is the real question that we would have to ask. Whether, and this is a notion that's existed since Greek times to Silicon Valley, the TV show, like drinking, blood from the youth. There's something in it that's probably helpful in this specific case.
Absolutely. Absolutely. That is a fascinating idea and a fascinating way of approaching it, and adding something to the whole mix of what we can do besides just TPA and roto-rootering the clot through a thrombectomy. Yeah, but and hey, gives us an opportunity to go ahead and consume the blood of our enemies. We're all set.
Or our friends, as a case.
Or our friends.
I think we should end there.
Absolutely. Absolutely. So much for my therapy goals of taking over the world. All right. Thank you so much for joining us this week.
Thanks for having me.
And that brings us to our hack of the week. If you struggle with communicating and meeting new people, whether it's due to your stroke or due to just other communication challenges, prepare a pre-printed bio and bring it with you when you're going to meet new folks. An attendee with aphasia came to our support group recently and brought just such a bio. When it was her turn to introduce herself to the group, she was able to just hand me that sheet and I was able to read it out to the group. This can be a great way to meet other people and can relieve a whole lot of anxiety. And if your anxiety about meeting new people comes from just how are you going to talk to them, this is a great way to address that. If you want to get fancy, you can even go ahead and laminate it. This can also be helpful even if you usually do speak well. Some stressful situations, like, for example, traffic stops, can make the words tougher to grab as the stress and the intensity of the moment gets to you. A pre-printed bio or introduction can help quite a bit. So, I really like the potential we have in remote ischemic conditioning. I like that this is a potentially simple, inexpensive solution that it's also something I could do at home while watching TV. Sure, it might be physically uncomfortable, but if it works, I think I can get past that. And for many of us, that discomfort may be minor compared to the other pain or discomforts that we just have to deal with on a regular basis. It can be just sort of one more thing. Of course, this is all still preliminary, and there's still plenty of research to be done. Another thing that's really interesting to think about is how something that's bad can still have positive outcomes. And yet, that doesn't make up for the problem itself. It's sort of a Mussolini made the trains run on time kind of thing. Specifically, the issue of smoking. As we heard in this conversation, smoking causes some of that remote ischemic conditioning by depriving the body of some of the oxygen that it needs. As we talked about, that means that smokers can actually have strokes that are less severe than the average stroke for a non-smoker. And that's a good thing, right? Except that smoking causes so many of those strokes in the first place. So even though it makes it less severe, the fact is that many smokers would not have many of those strokes if they hadn't been smoking in the first place. The best way to minimize the effect of a stroke is not to have one in the first place. Finally, the other thing about this episode that makes me smile is that it added the phrase vascular milieu to my vocabulary. And that is just a delightful combination of words. So to hear more from Nirav, head on over to strokecast.com/Nirav to find all of his Strokecast appearances. Be sure to tell a friend, colleague, relative, or patient about Strokecast and encourage them to listen over at strokecast.com or in their favorite podcast app. And, of course, as always, don't get best, get better. Thanks a lot. I'm Bill Monroe, and I'll talk to you next week.
The Strokecast, Bill Monroe, and Bill's guests provide general information and entertainment, not medical advice. Please do not make any changes to your treatment plan or the execution of your treatment plan without first consulting your personal doctor or medical team. The Strokecast is a proud production of the Currently Speaking Podcast Network.